So just to show that this is the 4th of 5 sessions, and today we're going to be talking about the actual health check, and you can see that I've put it quite far down the line because I think this is probably where it should sit. I think when we think about sequins, I don't know if you have sequins in targets what you have in Wales, but certainly in my travels around England, people focus so much on the health check they actually forget the reasons why they're doing it, and they forget that actually the purpose of the health check is to help keep somebody healthy, and they don't think about that in a day-to-day basis. So that's why we looked at those things in sessions 1, 2 and 3, because we can be doing stuff every day, and it's not just about measuring and recording and then saying goodbye, see you next year. Okay, so next slide, please. So the objectives of the session today are for you to be aware of your responsibility regarding monitoring a person when they've started to take antipsychotic medication, because that obviously the psychotic medication has got a lot of physical effects on the person. Then we hope that you will consider how to best organise a health check in your own organisation, because everybody has a different setup and the demands of their organisation are different. So it's to consider what your kind of barriers and enablers are within your own organisation. Hopefully you'll understand what elements are included in a health check and what you can actually deliver yourselves and what you feel may or may not be needed. And this is a big ask, I suppose, that after the session that you'll be motivated to want to make changes in your own practice that will help people with severe mental illness to be monitored appropriately. Okay, so next slide, please. Right, so this is what the NICE guidance says. So this is how it works. Certainly in England anyway. So primary care has the responsibility for monitoring when it's transferred from secondary care, and then at least once a year. So basically in primary care, the person, they have to do an annual physical health check. That's their responsibility, unless the secondary care are responsible. So what NICE says is that secondary care are responsible for any patients who won't go to primary care, and I'm sure there's people on your books that won't go to the GP even if they're registered. Obviously, if they're an inpatient, the GPs don't have access to them, so that would be the responsibility of inpatient doctors and nurses. And all those patients who've had newly prescribed antipsychotics or even just had their dose increased. So actually the responsibility there lies with secondary care to do any of the monitoring. That doesn't mean that they can send them off to the GP to have certain things done. It's down to secondary care services to provide that monitoring. Also, what NICE says, and this is kind of a strange one, that secondary care staff have a responsibility to ensure patients go to primary care for any monitoring and treatment that they might require. I think that's kind of really difficult to ensure, but certainly there are things that you might be able to do within your role to encourage people to go to GP services if that's required, because obviously that's where they'd access a lot of the care if they're within. Okay, so I've just put this up. This is a website that I created when I was doing my PhD on this subject, and it's kind of a repository for practice nurses or primary care staff. But actually it's got a lot of tools which are really useful for mental health nurses as well, because basically it's for anybody doing health checks. But also it's kind of if you were going to go into a practice, it's something you can talk to practice nurses about and guide them to, and to help them with their health checks. So I think actually part of your role could be to ensure people in the community are getting their health checks, because if somebody's in the community, then primary care are responsible. So part of your role might be getting the patient to the GP surgery to have their health check rather than doing it yourself. So now I'm just going to go through what you might think about having to do before you carry out an actual health check for somebody with a severe mental illness. And these are the things you might want to think about. So just go point by point. Just put the next point up, please. So one thing is to check whether the patient actually needs a health check, or has it already been done? Has it been done in primary care? Has it been done by another mental? Because I think that's really important because we shouldn't be repeating stuff. One, because it's not fair on the patient, particularly if it's, you know, something like a blood test. And the other thing is it's money that doesn't need time and money that doesn't need to be spent. Everybody who has contact with a patient should be able to see what that person has had done and what the results are and actually what the action's been. So some of this will be beyond your powers if you don't have the right systems in place. But I think as nurses and advocates for patients, it's something you can talk to your managers about and say this isn't, you know, if we're going to monitor the people's physical health well, we need a better system, or we need to kind of update our system or look at changing it. So it's something you can take back, I think. So you need to be able to organise clinics with the appropriate staff. So you need to discuss who's going to do it within the team, and have they had the right training? Do they know what to do? And actually, should everybody know what's involved in a health check, particularly for people who are difficult to engage with? And actually, if you're visiting a person because of their mental illness, you shouldn't be expecting them to come in to have a full health check, and what could be done as and when. Okay, next point. So make sure that the necessary clinical equipment is available. Have you got the right thing, all the things that you need, you know, scales, blood pressure machines, ECG monitors, venipuncture equipment, sharps boxes, couches, curtains, you know, all the things that you might, gloves, all those kind of things that you might need. Have you got them all? Do they work? Do they get checked if they're the sort of things that need to be checked regularly, like SFIGs and ECG machines? They need to be, you know, calibrated and checked and stuff like that. So is that all in place? And do you need to order a load of new stuff? Okay, next point. Is the environment that you're going to carry out the health check, is it good enough? Is it private? You're not being overlooked or overheard. You know, I've been to places where there's just kind of a curtain across and you're asking quite private personal questions and other people can hear. Is it warm enough? Is it accessible? So just to kind of be really critical and look at how you would feel if you were having some of those measures done in the place, and would you feel happy about that? Okay, next point. So when you're doing the health check, you should have appropriate information and leaflets available for patients. So whether you've got those printed out, ready to hand out, you know, having an array of them, or if you've got a computer in front of you with a printer where you can download something and print it off. It's certainly the website that I've got, you could link up to different leaflets and print them off. And I think leaflets are really good for patients if you've discussed the content with them. Just giving somebody a leaflet and saying, there you go, is a complete waste of time, unless you've kind of pinpointed its importance and maybe shown them the bits in the leaflet which are really pertinent to them. Okay, next point. So you need to be aware of where and how to refer patients when you identify a need. So there's no point in doing a health check, which is basically a kind of assessment, and then something's not quite right and you don't know what to do next, so you just leave it. So that's actually really bad. It's better off if it'd be better if you didn't even do it. So there should be a kind of, and I think we've talked about this earlier, a clear pathway of what happens for each kind of measure, where you'd go and who would do it and how you would do it. And that needs to be kind of really clear and easy so that you don't feel worried about that. Okay, next point. And you should know who you can ask for help within your organisation. So I think some people are put in, you know, some quite tricky positions sometimes, that something happens or they're not sure, and they really don't know who they can go to, or that the person that they think they can go to isn't particularly helpful. So that needs to be really clear and obvious, and that the person that they can go to for help should have that as part of their role. And I think nobody should be kind of left on their own with this, because there's always something that might come up that's tricky. Thank you. Next. Right, so we've invited the person to the health check. This is now we're looking at what happens once they're there with you in the room. And so the first thing, which might seem really obvious, is to explain to the patient why you're carrying out a physical health check. Because from the research I've done, and certainly research other people have done, is often that doesn't happen. And this is the biggest thing, and particularly in early intervention, from the beginning, often people aren't told when they're first diagnosed with a severe mental illness that they are at a higher risk of heart attack and stroke than anybody else. That it's even higher than diabetes if you have a severe mental illness. And, you know, when I worked in primary care, I used to have a conversation, I used to run the diabetes clinics. And when somebody was newly diagnosed with diabetes, the first thing we talked about was their increased risk. You have diabetes, therefore you're twice as likely to have a heart attack or stroke. Therefore, you must adjust your lifestyle accordingly. And that conversation very rarely happens, I think, with people with a severe mental illness. And it's a tricky one. And obviously, when the person's kind of in a psychotic state, it's not the time. But as soon as humanly possible, that conversation should happen, obviously, in a very gentle way. But if somebody knows why it's really important to change some of their behaviour and to look after themselves, they're more likely to do it. And at each health check, you should be explaining to the patient why you're doing it. We've invited you here today because you're at a higher risk of heart attack and stroke. We want to make sure that you're physically well, and we want to talk about all the things that you can do to prevent those things happening. And it's that kind of conversation that needs to happen. And certainly, you know, I've talked with colleagues in primary care. Often it's a healthcare assistant doing the health check, and they just go in and then it's just, right, sit down, blood pressure, and the patient doesn't get any explanation. And some of those staff said to me that they don't feel able to have those conversations. And if that's the case, you know, give them some written information. And I've got just a little A4 sheet on a website which I wrote with somebody with bipolar disorder, just to explain what the health check's about and what can be, you know, what to expect. So I've already said use some kind of template to guide you within that health check so that you know exactly what it is that you're going to do. And then give patients leaflets that are relevant if necessary. And then when you've done the health check, and if the patient needs a follow-up appointment, if humanly possible, it's always worth you arranging it for them and explaining why, because we know that some patients with severe mental illness find it difficult to actually motivate themselves, or just through their illness find it difficult to make an appointment or arrange things themselves. So if you can do it for them, that can make life a lot easier and save, you know, DNAs and missed appointments. and then tell them that the results will be shared with their GP or their practice nurse, particularly if it's something that they're going to end up needing to go to the GP to access some physical care about. Right, so what I've done is separated the health check into different sections. So the first section is the measurements. So the things that you might think about measuring, and your sequin targets, if you have sequins, will insist on some of these anyway. So the first measurement is to do a body mass index and or a waist circumference. So though waist circumference is kind of in public health terms the most accurate way of looking at cardiovascular risk, in practice it's actually quite a difficult measure to do, and it's one of those measures that people do incorrectly the most. I think people don't do it well. So I think a body mass index, which is height and weight, is quite a good start. And then to look at doing a pulse rate and an EIP. So I've divided this into the blood tests which I feel actually should be done at the health check, and then those to be considered. So the ones that should be done are liver function tests, obviously, because the high dose of antipsychotics is going to affect the liver, and then lipids or cholesterol, glucose or HbA1c. They're your cardiovascular risk markers, so they need to be done, because obviously the main point of this health check is to look at somebody's cardiovascular risk. So they have to be done. And then I've got a group of blood tests that you might want to consider. So if you could just pop those up, Sue, please. So for certain antipsychotics, you should be checking prolactin, particularly drugs like risperidone. Then urea, electrolytes and calcium, thyroid function tests, because people with severe mental illness have more metabolic risk, full blood count, because some of the antipsychotics can cause blood dyscrasias, and that would affect all the different cells in their blood. B12 and folate, that can be affected by poor diet. Lithium, obviously only if they're on lithium. And then vitamin D is kind of a tricky one, because vitamin D would only need to be done once. A lot of laboratories won't do it. It's thought about half the population, just standard population, have a vitamin D deficiency, but this group are considered to be more at risk of having low vitamin D. So that's something to consider. Okay, okay, next slide. So the next section is looking at screening of the patient. So this is kind of the kind of health of preventative work with the patient during the health check. And as I say, the health check doesn't all have to be done in one go. This can be done at different times by any members of the team. So discussing dental hygiene and dental visits, are people brushing their teeth? Or do they need prompting to brush their teeth? I mean, certainly I remember a patient saying to me, I said, do you brush your teeth? And he said, yes, I do. And his support worker, he was living in supported living, said, no, you don't. And he said, yes, I do. I did it last week. So there's kind of, he knew about brushing his teeth, but wasn't doing it regularly. So, I did challenge the support worker, saying, well, if you know that he's not doing it regularly, why aren't you in there prompting him? You should be recommending regular visits to the opticians. Some of the antipsychotics can have an adverse effect on the eyes, but we should be considering it anyway. Examining feet for neglect. This is something maybe people haven't considered, but certainly I've seen some pretty shocking feet when I was working in primary care. People taking the socks and shoes off and shedding half their skin. Great big long nails that haven't been cut for 5 or 6 years, causing all sorts of issues with walking and problems, which actually required podiatry, not just a chiropodist, but a kind of surgeon to sort sort this out. And I think, you know, you're not going to get people walking and doing stuff if their feet are in a state. And that's just kind of about giving them advice about washing and drying their feet and changing their socks. And, you know, are their shoes, do their shoes fit? You know, I've had patients that they've just picked up shoes from charity shops, so they're the wrong size and stuff like that. So if we don't look, we don't know. So I think that's something to consider. Again, you might not do it for every patient, but for those you might be a bit concerned about, it's a good idea. We should ask about problems with urination. Are they having any problems there? Inquire about bowel habits, particularly those on high doses of antipsychotics. We know that constipation can be, you know, a factor. And I've certainly, in Northampton, where I live, we've got a private, I don't know, you might have even seen this on the news, we've got a private hospital, St Andrews, and they've had 2 deaths from constipation, which is absolutely disgusting, really, that was missed. You know, that's neglect. So I think asking about bowels is really, really important. We should be providing them information and instructions about self-examination, so giving them, you know, leaflets and stuff, testicles for men and breasts for women, and actually think about men could get breast cancer too, so that's a consideration. And then in women, have they had their smear test? And again, try and encourage them to go and maybe help them arrange that appointment if they've got some fear, especially if there's been some trauma there in the past. And to talk about their menstrual cycle, because obviously antipsychotics can affect the menstrual cycle as well. Okay, so I don't think I need to go into this because we've talked about this in the first few sessions, but obviously lifestyle includes all these different elements, and they're just the same as we would with any other person, we would, and ourselves, you know, about sleep and smoking. There are just some extra things to consider when we're looking at smoking cessation with this group of people. So I think I've got that on the next slide. So smoking increases the metabolism of some of the medications, so that includes the antipsychotics that probably most of your patients are taking. So if somebody is reducing their smoking, then those medications need to be reduced as well, otherwise they're going to be over. So we really need to be aware if the person's started to smoke again or increase their smoking again when we've reduced the medication, because obviously if they go back to their original smoking or go even more, then they're going to be under medicated, and again then obviously they're going to show signs of their illness. So again, who's doing that? Who's doing that monitoring? Okay, next point. And then the drugs that you might prescribe to help somebody stop smoking can have an effect on the mental illness. So they need to be monitored really carefully, and they should have a plan, and they should be monitored every 2 to 3 weeks to make sure that those drugs aren't affecting them adversely. Okay, so go on to the next slide. So an annual health check should include a review of medication. So it may be, depending on how you set up your checks, it might be somebody different who's doing the medication review than is doing the rest of it, you know, blood pressure and stuff like that. Though, you know, you might have a nurse prescriber, mental health nurse who does the health check and can do this as well. So as with any long-term condition, patients are often reluctant to continue taking their treatment for a variety of reasons. So it's not just people with mental health problems that don't take their long-term medication regularly. People with diabetes, high blood pressure, high cholesterol, you know, it's a big thing. When I worked in primary care, all these people just think they can take them for so long and then they stop, or they don't take them properly. So that's kind of you know, something we need to really consider. So I've just got this is an infinite list. We need to provide information regarding their condition, as I said before. If people know why they're taking the medication, they're more likely to take it. So that's not just the, you know, severe mental illness medication, they're antipsychotics. It might be why they're taking statins, why they're taking antihypertensives, why they're taking drugs for the diabetes. And kind of this is what we need to be thinking about. So are they getting a holistic medication review? We shouldn't just be thinking about one drug. And I think this is where it gets kind of difficult when we're doing reviews, because often this doesn't happen. We need to give them the right advice about how important it is to take the medication as it's prescribed and not to miss doses. So often people don't like to take drugs through the days of the night. I mean, my dad used to just like take everything at once in the morning, and obviously they don't have that. They last for certain amounts of time, so it's not a good idea. Okay, we should explore their resistance to therapy, and that, as I say, obviously, you know, they might not have any insight into their mental illness. They might not have any insight into their physical conditions as well. I mean, I've had patients with diabetes telling me that they haven't got diabetes, even though they've been on medication for diabetes for years. So, you know, sometimes that could be an issue. We should anticipate that they might be misinformed about their illness or their treatment. You know, they might have had education about their illness when they weren't very well, or they've not had any decent education about their illness from when they had it years ago. So we should always kind of just touch base with them again and find out what they know and fill in the gaps. We should educate them to continue taking medication when they're feeling better and describe why maintenance therapy is important, because lots of patients think you take drugs for a certain amount of time and they feel okay, and then they don't think they need to take them anymore. And that's true of all conditions. And then we need to refer to the GP or the original prescriber as appropriate, depending on what the drug is. If people have side effects or they're unhappy about the medication. So the link, the link to the gas is on my website that I showed you previously, but actually if you just put it into Google, you'd find it. But it's the patient fills it in themselves, so actually anybody can administer it. Yeah, so I think it's a really good tool because it kind of gives you you know, an idea of the severity of side effects, but also kind of which area of the body has been affected by the drug. And actually, it can be a starting point to have conversations, particularly if there's kind of the impotence one. And, you know, if we think back to that session where we talked about that, it might not be the drug that's causing that. So it's kind of, you can use it as education with the patient as well. They've filled it in, you can have a look and you can discuss some of those points, because actually what they perceive as a side effect may not be a side effect. This is a very quick way to kind of get an understanding. So I think some of these tools are really helpful. Okay, the next slide. So I've just put this up here about what should be done for people on lithium. I won't go through the whole thing because it's usually done in primary care, but obviously if you're responsible in secondary care, if that person isn't in touch with primary care, it's good to know what to do. So it's telling you there about how often they should have the blood tests and looking at the side effects that the people might have and when you should consider that that person's toxic and need kind of emergency treatment. Okay, next slide. Primary care. And it was really to consider that as people have a severe mental illness, they have an increased possibility of cardiovascular disease, so therefore should they be offered the flu vaccine? And it's kind of a bit of an argued point at the moment, so that they're not on any register. They won't be called for kind of unless they've got diabetes or heart disease as well. So it's worth considering. And if you feel that your patient is at risk, so if they've got metabolic disease, metabolic syndrome, then they certainly should have it, but it might not be diagnosed. So that might be something you want to discuss with the patient and with your primary care services. Okay, next slide. Right, so this slide is just really going through the points that I went through at the beginning about what we should do to prepare to carry out health checks for people with severe mental illness. Okay, put the next point up. So, do they need a health check? Has it already been done? Next point. Have you got a system to invite patients if you work in the community? So think about that. Next point. How will you organise your clinics in practice? And if you are doing them already, do you think they work? Are you getting all the patients there? Are they good? Are they working well for patients as well as the organisation? Next point. Who runs the clinic? Have they had the relevant training? Could they do with some more training? Could they do with some more help? Are they being left to get on with stuff and they need help? Next point. Have you got the right equipment there? Have you got the right templates on your computer? Next point. Is the environment that you're carrying out health checks good enough? Would you feel comfortable if you were the patient having that done? Next point. Have you got the right information to give to patients? Have you got leaflets that you can give to them if you feel that they need more written stuff? Next point. Do you know where and how to refer patients when you identify a need? So if you pick something up, what are you going to do about it? Next point. Who do you need in your organisation to help you? What is it? What's making it a struggle? How would how could you improve this within your organisation? Who can you ask?